Hey there, and welcome back to my Heart Health series. Today, we're going to be talking about MTHFR. I'm Dr. Misty Sense, and I'm a chiropractor and functional medicine practitioner. MTHFR stands for methotetrahydrofolate reductase. So now you know why we call it MTHFR. And basically, this is a gene that produces an enzyme called MTHFR reductase. And this enzyme is responsible for metabolizing folate, which in turn is essential for converting homocysteine to methionine. Homocysteine is a necessary amino acid that plays an important role in metabolism, but high levels are related to a higher risk of coronary artery disease, stroke, and peripheral vascular disease. So, the intended use of the MTHFR genetic testing is, along with assessing homocysteine levels, to assess and minimize a patient's risk for cardiovascular disease through nutritional therapy and possibly clot prevention. This MTHFR gene is also responsible, or really related, I shouldn't say responsible, is also related to Alzheimer's and dementia in old age, and those with a variant do not detoxify chemicals well. So if you have one of the variants, you have a methylation problem. And that means that you cannot break down your B vitamins and they won't get used appropriately. Some other conditions that are associated with this MTHFR, in addition to the uh, cardiovascular and the thromboembolic diseases, such as blood clots, stroke, embolisms, is depression, anxiety, bipolar disorder, schizophrenia, colon cancer, acute leukemia, chronic pain and fatigue, nerve pain, migraines, recurrent miscarriages in women of childbearing age, pregnancies with neural tube defects, cleft palate, and other things like spina bifida and anencephaly. So there's a whole host of conditions that relate back to having a methylation problem. That's why it's so incredibly important to do this test on all of our functional medicine patients, not just the cardiovascular patients, but all of our patients. So, who is at risk for having a genetic variant? 70% of the population. 70%. 30% has two genes or two genetic variants, and 40% has one genetic variant. And as I said, there's a lot of conditions associated with this risk, and it's linked to 40 different diseases. One of the things I spoke about a few seconds ago is that when you have a variant, you don't detoxify chemicals well. Sorry about that. And so, who has been exposed to toxins? Well, 100% of the people have. And if you have a variant of this, your body cannot detoxify the chemicals in your body well, because B vitamins have to go into the liver to help the liver get rid of these toxins. But if the B vitamins are not broken down, the toxins are going to build up, and then you're going to have different conditions. So do you suffer with any of these that you see on the screen? And as you can see, there are so many different conditions that are related back to this variant. I mean, aches and pains, heart disease, depression, liver dysfunction, pancreatic cancer, hypertension, tachycardia. I mean, autoimmune problems, anemias, deficiencies in folate and B12. There's so many things associated with this variant that relate back to your health, that if we don't know about this variant, and we can't address it. And that's oftentimes why we see so many people come to our office and say, they've been to the medical doctor and they've tried everything that they said, but they still feel the same way. The reason? Because the body's biochemical processes aren't working properly due to this genetic variant. And so the body needs some very specific nutrients to help it get back on track. So listen, what gets measured gets managed. If you don't know you have this variant, you can't address it. And if you have it, you are at a higher risk of some chronic disease. And it can, like I said, it's linked to cardiovascular disease. As a matter of fact, it's linked to cardiovascular disease not associated with cholesterol levels. So you can have perfectly healthy cholesterol levels, and yet you have this variant and you're at risk for cardiovascular disease. Not to mention the other, 40 conditions that we just talked about and all those different symptoms. So it's so important to get this measured and know if you have it or not. Because if you know it's there, then we can address it. Because there are several of the B vitamins that require this activation through this enzyme before they're useful in the body. And you can't get the right type of B vitamins over the counter. They're not going to have the specific type of B vitamins that your body needs if you have a variant. So there's a very specific type of B vitamin that I use when people have a variant of this MTHFR. And that's this product that you see on the screen called Methyl Protect. It's inexpensive, but my patients notice a difference right away because it's filling in the gap for something that their body can't do. And this is something that the person will have to take for the rest of their life because it's for a genetic issue that won't be corrected without it. This is the only way to address that MTHFR enzyme deficiency is with these methylated B vitamins. So to wrap it up here, make sure you find a functional medicine practitioner and get them in your corner for your health. We went over some very specific tests in the previous videos, specifically looking at cholesterol, advanced cholesterol panels, genetic testing, the APOE, the MTHFR. Those are critical to know and understand so that you can best protect your health. Along with those genetic tests and the cholesterol, I also do check homocysteine levels, especially in my cardiovascular patients. But I also check the B vitamins, folate, B12. Because most people are deficient, even if they're already taking a B vitamin. And let's say they're taking a methylated B vitamin. Oftentimes I see it's not a great quality and it's not moving the needle on blood work. And that's what's so key. Not only do we check the genes and we check the levels of these vitamins, but we recheck the level of the vitamins after a specific period of time, usually 90 days. We're going to see the needle change on that blood work by utilizing the right lifestyle interventions, the right nutrition, and the right supplementation, specifically when it comes to B vitamins. So please find a